Well, welcome back, everyone. This is Jeannie White from Social Connections at Passionate World Radio. And today on the Whine Cheese, now I know I tell you I really like the Whine Cheese because it's a place to come and to chat. And today I have our guest is Bill, and I want to introduce Bill. Here you go, Bill.
Right. Thank you, Jeannie. I appreciate the opportunity. A little bit background of me. I've been a nurse for 17 years. If I include my EMT experience, I've been in the healthcare field for about 20. Almost all of my experience is based in the ED. Recently, I've kind of stepped and taken a different, stepped out a little bit of the ED, and I'm working in patient safety at the moment. I work out of Oregon at the current moment, and I appreciate the opportunity to speak about violence in healthcare. Is very near and dear to me. I, like many nurses, if you ask them, have been on the receiving end of violence. I can't count the number of times, but ones that highlight, I've been used as a spit target before. I've been clawed, I've been scratched, have been pinched. The one that sticks in my mind the most is having somebody get their hands around my throat and squeeze. And, initially it wasn't that bad, and then he squeezed harder, and then I got the adrenaline dump because I was starting to fear for my life. Now, back then I didn't know what to do. Now I do know what to do because I've been trained, and actually I've trained others. Since 2012, I'm a certified MOAB instructor. MOAB is one of those national programs out there that hospitals can use to teach violence prevention to their staff. MOAB stands for Management of Aggressive Behavior. And so my previous employer, that is what we used, and I became a certified instructor in that, and eventually became a clinical nurse educator in that program, overseeing the entire program and making sure that all the staff of all the hospitals, including the 6,000 nurses, were trained in that program. So trained thousands of nurses in MOAB. So my issues with, there's actually quite a few. I mean, I could spend hours talking about this, but we know that violence in healthcare is on the rise. We have the data to prove it. We have the national data to prove it. It's not getting any better, even though we're raising awareness, even though many national organizations have recommendations on it. They have position statements, white papers on it. It's not even just a problem in this country, in the U.S. It's a nationwide problem, an international problem. And so we're not unique in this regard. And Australia, Asian countries, India, the Middle Eastern countries, our friends to the north, the Canadians, South America, we all have a violence problem in healthcare. And one of the issues is I think we're studying it quite a bit. We're maybe not studying it as robustly as we could, but there's always more study needed. And from that, though, we need more action. I mean, if you just have a study and say we need to study more, it doesn't give me necessarily recommendations on what I can do or what we can do to actually combat the problem and help at least mitigate it more, or at least decrease the amount of violence that we're facing. So, the things that I look at is not only, yes, there's not a lot of action happening. I believe that security should be present in all hospitals. The problem is ubiquitous enough. If a hospital tells you that they don't have a violence problem, I think they're hiding something. I think there's enough evidence, no matter where you're at, no matter how big the hospital, that there should be a separate, dedicated security staff to help our caregivers, and I think at least one of them should be based out of the ER, because the data shows that this is where it happens usually the most often. Where I used to work, yes, that was true for all the hospitals we have. Our violence, the number one place was the emergency department. I think that we have some ownership in nursing. We have some ownership of the problem as well. We just can't shove it off to our administrators. We can't shove it off to our lawmakers. We can't shove it off to OSHA. We do not do a great job at reporting every single incident of violence. Now, a good portion of violence happens to us from people who don't intend to hurt us. I think that's a study that needs to be done is let's look at the intentionality of violence towards us, how much of it is unintentional versus intentional. I think we can all agree that most of it is unintentional. So, but I think we don't report it when we consider it unintentional. It's like, oh, they didn't mean it. You know, it takes me time to report it. Why even bother? I think that reporting is being highlighted, that reporting deficit is being highlighted in the literature and with the national organizations, but I think we could do a much better job in that. Now, if your facility does educate you on de-escalation techniques and even physical techniques, they're only going to work if you practice them. So I know it's a huge budgetary constraint to bring in these training classes, but you need to practice, right? The less you practice your skill, the less effective it's going to be when you need it. And you got to remember that these skills are good for you outside of work. Any de-escalation skill or even self-defense skill is good outside of work. I think hospitals need to have a very, very, very clear policy about workplace violence. It needs to be its own dedicated, separate policy. It needs to address how you assess your workplace violence risk. It needs to tell people how to report, when to report. It needs to address what happens before, during, and after violence in healthcare. How do you support the caregiver after it happens? What is the protocol in contacting law enforcement? And one big question I would like policies to answer is, can the caregiver use self-defense if they have to? The previous place I worked, it was very clear in their policy. It says yes. Current place where I work says self-defense means that you're going to hurt the other person, and that's not appropriate in health care. So I read that as, no, you cannot. And we hear that frustration in social media. If a nurse does get assaulted and they do want to press charges, it should be their legal right. The hospital should have no say. But you have to realize also that the nurse has to be willing to play the victim. You have to be willing to go to court. You have to be willing to take time off of work, and hopefully your employer supports you in that. But you have to be willing to play the victim, and we're not good at that. I don't think we're good at that. We're very stoic. We're very, I can handle it. There's a little bit of martyrdom in there, but I don't think that helps us in this situation. And I think nursing and healthcare in general, we can do a much better job of supporting each other when violence happens to us. Sometimes you read this on social media, and this is a large complaint that they don't get support from their managers, their directors, their administrators. Sometimes they put the blame on the nurse, and what did you do to cause this? And even on social media, we hear accounts of nurses saying, like there's one recent one in New York happened where a nurse followed a patient out. He wanted to leave, and she followed him, and she happened to be pregnant, and he punched her in the stomach, and she lost her baby. Well, one of the responses was on social media was, well, this nurse is performing duties of security. She shouldn't have done that. So here we are blaming the victim, and she lost her child, which I think, is this nurse bullying? Is this nurses eating their young? I think this is a good example of that. And I think we can do a better job nursing-wise. Now, OSHA has said that they're probably going to make a standard that would require all healthcare facilities to provide violence prevention education, but that's going to be years away. So I think on the state level, we have to do our own. We have to work on our own hospital level. We have to work on our state level. Here in Oregon, we've tried twice to make it a felony to assault a healthcare provider. We tried in 2015 and 2017. I had the opportunity to present testimony both times, and we still don't have it. But that's another research question: is do these felony protection laws do they help? Do they work? And that's a good question, because we could be putting all this effort into it and it doesn't really do a darn thing. So there's many topics around violence in healthcare that we really need to dig down and dig deep. You know, every one of these incidences at a hospital should have a root cause. We need to dig that deep. We need to put that much effort into it. Goodness, we put so much effort into looking at errors that happen medically, medical errors. That's part of what I do in my job currently. But we don't really do that with incidences of violence. And yet we're confounded when we see the incident number rise, and we kind of put it on the back burner. It should be in the front burner, because we all should have a safe place to work. And, it is frustrating, but we have a lot of work to do. I think that's my 10-minute rant.
Oh, that was excellent, Bill. You brought up some really good points. And I seem to feel that I hear the same thing about nurses not doing reports. I've heard this quite a few times now. So that's something to really think about. But I thought it was, you made some great points, and I think the part about the education, about giving some training to the nurses to protect themselves if they get into a bad situation and how they can handle it. I think that's an excellent point that you made, that what you do. I'm sure, can you say the name again? MOAB, is it?
MOAB. MOAB stands for Management of Aggressive Behavior. And that's just one course that's out there. There's non-crisis or nonviolent crisis intervention, also known as CPI. There's quite a few commercial products out there, and I know some places develop their own, and that's okay too. But there's options out there. It's not like they haven't been around for a while, and I'd be very surprised that hear of a hospital that does not provide training for their staff. But I know they're out there.
Mm-hmm. I think it's important, that, and like I suggested to some of the other individuals that came on, at some point, if we build up this community, you're all in different parts of the country, and you can get together on a webinar or whatever, a conference, and maybe try to talk about solutions or what you do or what Mary, whoever it is that's in another state doing. I think it's important to know that these nurses are not alone, and by doing this little segment I'm doing, I think it really just shows that there are many individuals out there that are working in different parts of the helping to assist in the violence, and you're one example of it. What you're doing.
Yeah, I think another issue is the disjointed effort that is going around. There's different groups trying to tackle the same problem, and yet here we are. Nursing is the largest healthcare workforce in the United States, and here,
right.
That's a known problem that we have.
Yeah,
is we can't seem to get together.
Right, but I think because now of obviously social media and everything, and then me doing some of these segments for you and putting it out on the internet, and putting it out wherever it's supposed to be. And you're going to find people that want to come together and either show what they're doing or you showing what they're doing and how you can incorporate it all together. But we have to start somewhere, and I think this is the best thing about trying to do this. You find out that I'm finding out that there are many out there that are working on something, and it'd be good if we could pull it all in, Bill.
That's true. That is very true.
So you're more than welcome to come back on. You don't necessarily have to rant. You could come on and, and give suggestions or, ask for, people to, even through your Facebook, to connect. And that's how it works, really, I think, in anything. Yeah. But I think one of the things I feel is nurses trying to help them provide an easy way to get these documents, these reports filled out, and that could help a lot also. And I think you're also true. From what I hear, sometimes it's not always, nurses are compassionate with another nurse that got hurt. It wasn't that bad. Are you making more out of it, et cetera, et cetera.
Yeah.
But that's in any group that does that.
That's true.
But I just wanted to point it out. Those are the two things. I'm not a nurse, so these are the things that I see. I don't know if I would have been able to handle it. I would have said, here, take it. I'm not doing it. I don't want to go to work to get beat up.
Yeah, and it's unfortunate, some do leave the workforce just because of it.
Yeah. Yes. And some of them that, I know one particular nurse that, she loved it. That was her dream job, is to go there and to be a protector of health, and in turn she got hurt very badly and she couldn't go back. So that's a shame that she had to leave her profession. But you have to start somewhere. The picture is big, but if we just take pieces of it and see if we can chip away at it, and I'll help any way I can.
We appreciate it. We do.
Yeah. But if you ever want to come back, just let me know. All right.
Oh yeah, I would love to, and I really appreciate the opportunity today.
Yeah, thank you. It took time out of your busy schedule. I'm certainly sure your schedule as a nurse, you're out there. It's like as soon as you get there, your feet are running. You're going constantly.
Yeah.
And so I appreciate all the nurses. Trust me, I really do. I think they're fabulous. And we want them when you're not feeling well. Trust me, I think.
Oh yeah.
Yeah. Well, look at Bill. Thank you so much for being on this segment of Whine and Cheese, and we'll see where it goes. Yes.
So hopefully we make some movement at least in these next couple years.
Yeah. Well, let's try it a year. We'll try for a year. See what happens in a year. You never know.
Okay.
You can really move mountains. But anyways, thank you again, Bill. I hope you have a great day. And thank you for participating in this, very unbelievable topic.
Yes, thank you again.
Okay, thanks, Bill. Everyone, I want to thank you for listening to the show again. This was really interesting. Bill brought up some really good points about different issues that are going on in the healthcare industry. And if you have any comments or suggestions for Bill, you can always call me email me at jwhite7033@comcast.net. Again, thank you, everyone. Have a wonderful day off. Enjoy. Bye now. Again, as I'm going to say, Passionate World Radio. Thank you.